Good day, class. In the previous videos, we have introduced angina. In this video, we are going to introduce one case. Although this case is not angina, this is actually acute myocardial infarction. Angina and myocardial infarction are all in the category of coronary heart diseases. Myocardial infarction is more severe than angina. But the treatment principles from acupuncture will be very similar. That's why we share this case. This was a case that I saw accidentally a few years ago on the 5th August 2017. I went hiking with a group of friends in the west of Johannesburg or northwest of Johannesburg, so not far from Johannesburg, and we went for a 4 days hiking. On the last day, we met one patient on top of the mountain. So accidentally, actually this is not our original route. We changed the routes on that day and met this patient on top of the mountain. Let's see what happened to that patient. I met this patient at about 12 o'clock at noon. So that's when I met the patient. We walked past a group of people. They were gathering together around the patient. And then there was someone asking, is there any doctor there? And then my friends told them that I am a doctor. So I went forward and then I asked the situation. The patient told me that he suffered from chest pain, burning sensation behind the sternum, so in the chest. This patient got heart attack before, so he knew that this might be a heart attack. He stopped. He was resting. After 10 minutes, about 10 minutes, another group of people, they walked past by. Very luckily, there was one lady took aspirin, grandpa. The other lady took aspirin, and then this gentleman took aspirin at this time, at 20 to 12. When I met this patient, already 20 minutes passed. But when I meet this patient still feel severe pain, burning feeling in the chest. So what can we do in this situation? Or if you were me, when you see this kind of patient, what happened to that patient? What's the first thing you need to think about according to your study? So firstly, match the patient here. The patient presents as chest pain. Okay, when we studied in the previous videos, I emphasized the 5 aspects of heart attack or the angina. The location, the chest, behind the sternum, the sensation, the nature of the pain, burning sensation, the duration. Okay, we're going to discuss the duration now. The patient took the medicine. Although aspirin is not the specific medication to relieve the chest pain, but this patient was suggested to take aspirin at this time from conventional medicine point of view. How to relieve? So what trigger? What's the cause of onset? So the location makes the angina, the sensation, the nature of the pain, the duration, and then this patient was walking, hiking up hills. So this may trigger the pain. Excess work or excess exercise increase the need of the oxygen of the heart. So that also meets the angina. Take medication, although this medication is not accurate. But when you see this situation, from 11:30 to 12 o'clock, half an hour, 30 minutes. Remember how long we set for the duration of angina. A few minutes, less than 5 minutes. The pain must be relieved by resting. So you will see in this situation, this patient suffered from chest pain, but didn't relieve after a few minutes. The pain still there for 30 minutes. Take medicine, resting doesn't help. Although this medicine, as I mentioned, emphasized quite a few times, this is not the medicine to relieve the pain, but this is also the correct medicine that the patient need to take to prevent the blood clots. When we see this kind of diseases, we didn't introduce in the previous videos, but these are the information you need to study for the diagnosis and differentiate diagnosis. For angina, what other diseases you need to think about? A patient presents with chest pain is not always angina. It may be angina, it may be acute myocardial infarction, aortic dissection, acute pulmonary embolism, acute edema. All these diseases you need to differentiate. Especially, although you may have other diseases that also may present as chest pain, especially these diseases you have to differentiate because these diseases may have different treatment principles, may have different managements. What's worse is all these diseases are all very severe. Some of these diseases, patient may pass away in a few minutes. Acute pericarditis. That's from clinics. When you see one symptom or one disease, that's all differentiation you need to think about. You need to exclude all other diseases, then you can focus on one. So let's see what's coronary heart diseases. Coronary heart diseases or coronary artery disease develop when the coronary artery becomes too narrow. So the wall of the vessel becomes thicker. It may due to the accumulation of the fats due to cholesterol become thicker. So the vessel become or the artery become narrow. The most common diseases: angina, myocardial infarction, or even heart failure. Especially the myocardial infarction is one of the most common cause of death. And recent years, you can see the case is increasing. From 2000 to 2020, the death from myocardial infarction ranking from the 5th to the 1st. Stroke from the 6th to the 4th. The mortality rates of cardiovascular diseases. In the developed countries, they have the chance to reduce, but in the developing countries, especially China, India, have the chance of increasing. Cardiovascular disease is the leading cause of the death globally. In 2016, 17.9 million deaths caused by cardiovascular diseases, and coronary heart disease is one of the most important disease in this category. 80% of the case happens in the low or middle income countries. In 2017, there were about 8.6 million deaths in Europe. Almost 45% of these deaths were contributed by the cardiovascular diseases, which mainly refers to the coronary heart diseases and stroke. In these 45%, about 3.9 million deaths, coronary heart diseases contribute 1/3 of death, almost 1.3 million per year in Europe. These are all the different factors that may affect the prognosis of this disease, such as the age, the time delay to the treatments, the treatment strategy, diabetes, the number of the diseased coronary arteries, the history of the heart attack, the renal failure, LVEF. In male at age below 60, male presents as 4 times more than female. But above the age of 75, the female presents more. This is what we were emphasizing previously, angina. Increased loads on the myocardium include acute temporary ischemia. So either you increase the need or the reduce of flow. The location, the nature, the causes, duration, and treatments. This is the medication to relieve the pain. The common symptoms of the acute myocardial infarction: severe pain, gastrointestinal symptoms, such as the fullness in the abdomen, hypertension, low blood pressure, even shock, arrhythmia, heart failure, various other systematic symptoms. So as you can see from these manifestations, AMI is much worse or much more severe than angina. The common symptoms, the patient also may present as anxiety or accompanied by anxiety, irritability, pale complexion, excessive sweating. The anxiety also may due to the feeling of, some patients may present with the feeling of death, and also due to the severe pain may cause anxiety. Physical signs, the blood pressure, the temperature, the body temperature, and breathing is something we need to focus on. As mentioned previously, the diagnosis of angina or AMI or other coronary heart diseases should not be based on clinical manifestations. We must find proof. So the diagnosis must be based on the evidence from the images. But for this situation, the initial diagnosis will be based on symptoms. The initial diagnosis based on the symptoms of consistent with myocardial ischemia. The patient mainly presents as pain, chest pain. Some other diseases that we need to consider, such as the cervical diseases related to the cervical vertebra, the neck problems. The patient may present as stiffness, numbness in the arms, in the upper extremities. So that also sometimes may present as the left arm, that's similar to the heart attack. The diseases related to the dental problems, the pain in the cheek. Patients that suffer from diabetes may present as atypical symptoms, even without pain. Even without pain in severe condition, because patients suffer from diabetes may also suffer from neurological changes, which was one of the most common complications of diabetes. In elders, they may present as difficulty breathing or heart failure quite easily. So especially a patient present with diabetes, this is also very common nowadays. We need to be careful. So in this situation, you must send the patient to the KOT, or if you suspect that this patient got a heart problem, you need to prescribe the blood test. Almost half of the patients will pass away within 1 hour, even before arriving hospitals. The delays in seeking treatments, the delay in transfer, in diagnosis, and the examinations or preparation may all contribute to the mortality of this problem. Now we already know this disease is quite severe, but how Chinese medicine, especially traditionally, how we understand this disease. So traditionally, this disease is in the category of chest B. When we study the B-pen syndrome, the B syndrome, we understand that this term BI, refers to pen, a kind of pen. That's why we said B-pen syndrome. So in Chinese medicine, we say chest B. It actually means chest pain, or sometimes in other texts, you write the heart pain. The possible causes: age, deficiency of antipathogenic qi, the impairment of Zangfu organs, yin yang qi and blood imbalance, internal injury from the 7 emotions, that's the endogenous pathogens, improper diet, the cold environment, overwork, or other causes result in qi and blood stasis, qi stagnation or blood stasis. Chest yang deficiency, phlegm, results in stasis. So these are the possible causes we have introduced at the beginning of the angina. The onset, Zangfu meridian, qi and blood dysfunction, imbalance of yin and yang. Even until here, we didn't describe anything that's actual can reflect the disease. Because these terms, imbalance of yin and yang, can be explained to any different kinds of diseases. But from the pathogenesis, it mostly related to the heart, but also related to all other organs. So 5 Zang organs are all related. It's the root cause of the deficiency of the 5 Zang organs. It may be qi deficiency, it may be yin deficiency, yang deficiency, or even yang depletion. It can be qi stagnation, blood stasis, phlegm, cold stagnation. The manifestation is excess, the cause is deficiency. So the deficiency is the antipathogenic qi, but in the meantime, the patient may present as excess. That's why in the treatments, we can use Moxibustion for the deficiency, but in the meantime, we can use acupuncture for the excess, the combination of acupuncture and Moxibustion. Chest B can be categorized into different categories. So from Chinese medicine point of view, Chinese medicine knows the disease, the different disease of angina and acute myocardial infarction very early. Chest B, sometimes it refers to angina, sometimes it refers to acute myocardial infarction. That's also why in some texts they use different terms to try to identify the difference between these two terms. So chest B, in the other text, it is described as true heart pain or true pain of the heart. The 绝 heart pain or the 绝 pain of the heart. True, because this pain is quite severe, so it emphasizes this is a true heart attack or true pain. This is just the direct translation from Mandarin. 绝 heart pain. So from the title terminology, it already differentiates different type of chest pain. Some are in the category of angina, some are in the category of AMI. From 黄帝内经, the first volume, 素问, in the chapter Discussion on Pain, the emperor asked, what's the reason of sudden pain of the 5 Zang organs? Qi Po answers, the qi constantly circulates in the meridians without an end and a start. So that's where the qi and blood circulation, when you study the 12 meridians, we say that these meridians, they run as a circle. Start from the lung, the large intestine, to the stomach, and all start run in a circle without an end and a start. If the coldness enters the meridian, it will result in slow down the circulation. If the coldness attacks the area outside the meridian, it will result in a lack of blood. Attacking the meridian, if it attacks within the meridian, it will result in qi blockage, which further results in sudden pain. This clause was a direct translation from the Huangdi Neijing, the text. The last two sentences, if attacking outside the meridian and attacking the meridian within the meridian. This is a habit in the Chinese literature. So it actually refers to if the coldness attack both inside and outside the meridians, it will result in lack of blood and qi blockage. So from this clause, from Huangdi Neijing, it describes that the chest pain may be due to the fact of a lack of blood or qi blockage or qi blockage. So that's where the pathogenesis comes from, lack of blood, qi blockage, the malnourishment of the parts. In Lin Shu, the second volume of the Huangdi Neijing, it describes more clearly the true chest pain. So as you can see here, from Su Wen and Lin Shu, the first and the second volume, at that time, Chinese medicine already identified the normal chest pain and the true chest pain, so the severe condition and the normal condition. So this is the normal condition more refers to the angina. The true chest pain more refers to the acute myocardial infarction. Also, the practitioners already knew the severity of this disease. In true chest pain, the hands and feet will become bluish till the joints. This is the bluish blustasis. So when we study the manifestations of AMI, the poor circulation or even shock, that's what happens at this situation. The coldness become bluish, severe chest pain. The patient will pass away. In the afternoon, if the pain starts from the morning, the patient will pass away in the morning if the pain starts from the afternoon. So this actually emphasizes the severities of the disease. If the patient suffer from chest pain, the true chest pain, this morning, the patient may pass away in this afternoon, only a few hours. If the patient suffer from the pain in the afternoon, the patient may pass away in the second morning. Emphasize how severe this disease is. The patient may pass away in a few hours. 金匮要略. This is the second volume of 伤寒杂病论. We also describe that when taking the pulse, if the pulse presents as yang faint or yang weak and yin wiry, the patient will present as chest B with pain. The reason is extreme deficiency. The yang deficiency is in the upper jaw. Therefore, the reason of the chest pain or the heart pain is due to the yin wiry. When you see this clause, it's quite difficult to understand. You all talk about yin and yang, faint and wiry, but what does it mean by yin and yang? Here, the patient presents with chest pain. Why the patient will present with chest pain? Yang fans. What does it mean by yang fans? So in the pulse diagnosis, when we differentiate yang and yin and yang can be used to two different aspects, opposite aspects, superficial or deep. So when we take in pulse, the superficial compared with the deep area, the superficial area is yang. So it describes that when you palpate superficially, the patient presents as faint or weak. When you push deeper, it's wiry. Superficial, extremely deficiency, extremely deficient. Yang deficiency is in the upper jaw. Yin and yang, apart from when we diagnose the pulse, so that's the hand. The pulse, it can describe yin and yang from the different levels, upper level, medium, or deep. That's how when we take the pulse, we're going to feel these three levels. Superficial is yang, medium, and the deep level is yin. But when we see from the other aspects, when we see from the chun, guan, chun, guan, ci, these three locations, yang weak, yin wiry. You also can see the yang, yin. The front part is yang, the back is yin. So it's weak in upper jaw. The deficiency in upper jaw. Wiry can present as pain. In the lower jaw, also can present at the bottom in wiry. So if you understand this clause, the author Zhang Zhongjing already told us that this pain is due to deficiency. The root cause of this pain is due to deficiency. In another clause, describe the chest B, the patient cannot lie down. The heart pain radiates to the back. 瓜蒌泻白半夏汤 can be applied. 瓜蒌泻白半夏汤 is a name of the formula, so a title of the formula of the prescription. But we don't focus on the herbal medicine, so we don't need to write about the prescription, but from the description, describe that this patient cannot lie down because feel severe pain. The heart pain radiates to the back. Another possible reason why the patient cannot lie down. Nowadays, we know that the patient may accompany with heart failure. The patient presents with heart failure, while when they lie down, they feel worse because of the edema in the chest. They feel the shortness of breath. It will be worse. So the patient will, if they in a severe condition, if in hospital, the patient will be required, or the patient actually will prefer to be seated. In another clause, heart pain radiates to the back pain radiates to the heart. 乌头刺实指丸 can be utilized. So another clause describe the heart pain, the chest pain. You all already have described different symptoms that we can see today, which means the diseases have never changed. 备急千金药方 in Tang Dynasty. This is about 1,500 years ago. Dr. Sun Simiao, he described that chest B, patient may present as chest fullness, chest pain, colic pain, feels like stabbing. Patient feels discomfort either lying, supine or prone position. So no matter what type of position, the patient doesn't feel good. Pain even on the skin of the chest, dislike palpation. The patient may present as chest fullness, shortness of breath, coughing with dull pain, irritation, itching throat, dry throat, nausea or vomiting, irritation, spontaneous sweating. Pain radiates to the back. the patient may pass away in a few days if without any treatment. From this clause, you will see that Dr. Sun Simiao already gave us more comprehensive manifestations of this disease. And also, he described some symptoms that related to deficiency. Dr. Sun Simiao also realized the severities of this disease. The patient may pass away in a few days. He proposed the treatment from Moxibustion. Chest B, radiate to the back with cold sensation. You can select间室, so it's SHI. Pericardium 5. You can select pericardium 5. Chest B with pain in the heart. You can select 三焦 10. Chest B with pain in the heart, accompanied by shortness of breath, pain in undetermined sites, which means the pain can be here and there. You can select 灵气. 灵气, I write here GB15 or GB41. The reason is because in Mandarin, GB15, 头灵气, the 灵气 in the head. GB41 is 灵气 in the foot. But Dr. Sun only mentions the 灵气, so we don't actually know which one he refers. So that's GB15 or GB41. Chest B with pain in the heart. Moxibustion on the row 17. With 100 crowns. So how long you need to muster on row 17? You can muster a lot until the pain relief. Not suitable for needling. Why not suitable for needling? Because this is a situation the patient suffers from qi deficiency, yang deficiency. That's why we use Moxibustion to strengthen the qi and yang. Needling technique with filiform needles may consume the qi. So in this situation, preferably we can use Moxibustion. Chest B, with fullness of pain, we can Moxibustion on level 14, 七门. So these are the treatments from Dr. Sun Simiao. Medical scripts in 3 characters. This book was written in late 19th century. The practitioner, Chen Xiuyuan, he compiled this book. He actually rewrites our medical theory, the history, the theories, the basic theories, the clinical applications. He rewrites them into 3 characters. It is actually simplifies the theory and also make it very easy for us to memorize, because when he writes in 3 characters, it sounds like a song. So we can memorize the song according to the song. He described that there are 9 different types of pain in the heart and the stomach. One is suggested to differentiate the excess and deficiency syndromes and clarify the severity. So as you can see here, in the clause, he combined the pain in the heart and stomach. He combined them together. One of the reasons is because the chest pain or the heart pain, especially the true heart pain, may accompany with the discomfort in the stomach. That's from the AMI we have introduced in previous videos. The pain is due to blockage, the accumulation of qi and blood, where the pain-free, how to relieve the pain, or why the patient there's no pain there, is due to no blockage as a result of harmony. So he emphasized the blockage. It can be the qi blockage or blood blockage. The blockage of the blood is bloodstasis. So you already gave us the pathogenesis, the etiology, how to analyze this problem. These are different symptoms and prescriptions from Chinese medicine, internal medicine. So if we study herbal medicine, then we will study all these aspects. So you can categorized into excess and deficiency. Excess can be different internal causes. Deficiency may be qi, yin, yang deficiency. It may be related to different organs. These are the understanding from internal medicine. In next video, we are going to continue the discussion of this case, how to treat this case at that specific situation. Thank you for your attention.